Everybody, so today's medical moment, we're discussing meniscal tears. So your knee has two menisci, one on the inside, one on the outside, and they're basically the big cushions for your knees. And their injuries to this area are one of the most common reasons to visit the orthopedic surgeon. The big misconception is that all meniscal tears are not created equal. So when you're younger and you tear your meniscus, it tends to be like a big sports injury. Sometimes you tear your ACL, sometimes it's a multi-ligamus injury, and often surgery, you have to actually repair the meniscus, which is a pretty long recovery. You can't walk on it afterwards. You have to do a lot of rehab because you want to preserve as much meniscal tissue as you can. Sometimes, if it's not salvageable, you'll even get a transplant of a cadaver meniscus so that you don't develop arthritis later in life, or you don't develop as much arthritis later in life. But once you start getting a little bit older, the tear types change dramatically. So you can have a bigger tear when you're older, but a lot of times they're the smaller, more annoying tears, and sometimes they can't be repaired. So what the surgeon does, if it's symptomatic, is they go in there and they remove as little meniscus as possible. So they take out the bad stuff, but leave as much healthy stuff as possible. So think about it, sometimes the older tears just aren't fixable. You can't put stitches in it. And sometimes it's not a big injury. Sometimes it's as simple as turning your knee in the kitchen. My wife did it playing tennis. She was still able to function, but it just kept annoying, kept locking her knee, these kind of things. Now, the big misconception is that once you get to a point in older age where you have a significant amount of arthritis, the arthritis is way more important than the meniscal tear. So we see it frequently where people come in with their MRI and they have all these circles saying where their meniscal tears are, and these people have bone-on-bone arthritis. If you have bone-on-bone arthritis or even significant arthritis, then surgically cleaning out the meniscal tear is not going to help you at all. So that is the big misconception, is sometimes older people really want to get an MRI when really all you need is an X-ray. If you see a certain degree of arthritis on an X-ray, you know that the meniscus is torn, but it's not torn like that young athlete tears it. It's more just ground away. And with arthritis, you have inflammation because you have lost your joint cartilage, and that is your main issue. And that's a whole different treatment plan. So that's the big clarification. Often an X-ray is more needed than an MRI and is way more valuable. So hope you learned something.